The story of antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, like Prozac, Zoloft, and Paxil, is another unsettling example of how the pharmaceutical industry has exaggerated benefits, downplayed limitations, and strategically framed mental health treatment in a way that maximizes profit, often at the cost of nuance, transparency, and informed patient choice. While these drugs have undeniably helped many individuals suffering from moderate to severe depression, their widespread use, especially in cases of mild or situational depression, rests on a narrative that has been skillfully engineered more by marketing than by evidence. This overstatement of effectiveness has turned SSRIs into multi-billion-dollar products while raising legitimate concerns about medicalization, dependency, and the oversimplification of complex emotional distress. When SSRIs were first introduced in the late 1980s and early 1990s, they were hailed as revolutionary. Unlike older antidepressants with harsher side effect profiles, SSRIs were promoted as safer, more tolerable, and scientifically targeted. They were said to work by correcting a chemical imbalance in the brain, specifically a deficiency of serotonin. This serotonin hypothesis quickly became the dominant explanation for depression in the public imagination, despite being a theory with weak empirical support. As subsequent reviews have shown, there is little conclusive evidence that depression is caused by low serotonin levels, yet this narrative was aggressively repeated in advertisements, patient leaflets, and even some clinical settings. The simplicity of the message, "You're depressed because your brain is low on serotonin, and this pill fixes it," was emotionally persuasive and commercially brilliant, but intellectually shallow and scientifically unproven. This framing allowed drug companies to market antidepressants as a kind of universal remedy for sadness, stress, and discontent. As the cultural stigma around mental health softened, prescriptions soared, not just for those with severe, persistent depression, but also for people experiencing temporary life distress, bereavement, work stress, or subclinical mood changes. What was once considered a normal spectrum of human emotion began to be reclassified as a disease state in need of pharmacological intervention. Doctors, often operating under time constraints and lacking access to alternative therapies like talk therapy or lifestyle counseling, found it easier and faster to prescribe a pill than to unpack the social, psychological, or existential roots of a person's suffering. Yet, when examined rigorously, the evidence for antidepressant efficacy, particularly in mild to moderate depression, becomes less compelling. Meta-analyses, including those conducted by researchers like Irving Kirsch, suggest that for people with mild or moderate depression, the difference in symptom improvement between SSRIs and placebo is often minimal. In many trials, placebos perform nearly as well as the active drug, raising the uncomfortable possibility that a significant portion of antidepressant benefit may come from expectancy effects rather than pharmacological action. Importantly, these findings are not widely known by the general public, and they were long suppressed or minimized by pharmaceutical companies that had little incentive to advertise the modest limitations of their flagship products. The profit motive is central to this narrative. Drugs like Prozac and Zoloft became blockbusters, generating billions in revenue not because of their specific biochemical power, but because they were sold as a cure for an increasingly broad and vaguely defined condition. Pharmaceutical companies also shaped the clinical research agenda by sponsoring trials with favorable designs, selectively publishing positive results while burying negative or inconclusive studies, a practice known as publication bias. This distorted the scientific literature, skewed clinical guidelines, and contributed to an overly optimistic picture of antidepressant efficacy. Regulators, while aware of some of these issues, often lacked the transparency requirements or political will to force full disclosure. Meanwhile, the risks and downsides of antidepressants are often understated. While SSRIs are generally considered safer than older antidepressants, they still come with side effects that can be severe and persistent. Sexual dysfunction, weight gain, sleep disturbance, emotional blunting, gastrointestinal issues, and, in some cases, increased suicidal thoughts in young people. Furthermore, withdrawal symptoms upon discontinuation, often euphemistically labeled discontinuation syndrome, can be distressing and prolonged, sometimes mimicking a relapse of depression. Yet, many patients are not adequately warned about these effects, and prescribers often underestimate the difficulty of stopping the medication, leading to long-term use even in cases where it may no longer be necessary. This is not to deny that antidepressants can be life-saving for some people. They are an important tool in the psychiatric toolkit, especially for those with severe, debilitating depression or suicidality. But the problem lies in how this tool has been framed and deployed, not with clinical caution and individualized care, but with the broad brush of mass marketing, oversimplified messaging, and systematized overprescription. The result is a generation of people who may be medicated unnecessarily, misled about how the drugs work, or never offered alternative therapies that might better suit their needs. In the end, the antidepressant story reflects a deeper conflict in modern medicine, the tension between treating symptoms and understanding causes, between marketing convenience and scientific complexity. When pharmaceutical companies overstate the power of a pill to fix human suffering, and when medical systems lack the time or resources to offer holistic support, we end up with an overmedicated society that confuses emotional struggle with biological dysfunction. The cost is not just financial, it is also personal, existential, and ethical. The promise of better mental health cannot be fulfilled by drugs alone, especially when the very premise of their benefit has been inflated in the name of profit.